You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
You're listening to the NASP Specialty Pharmacy Podcast, a collaboration between the National Association of Specialty Pharmacy and the Pharmacy Podcast Network. Each episode dives deep into trends, challenges, innovations, and patient-centric practices shaping the future of this dynamic and rapidly evolving industry. Whether you're a pharmacist or healthcare provider, patient advocate, or industry leader, you'll hear expert insights, real-world evidence, and thought-provoking discussion that highlights all that makes specialty pharmacy special.
In support of NASP's mission to empower specialty pharmacy stakeholders to advance the standard of patient care, NASP supports a free market healthcare system in which all specialty pharmacies compete on the same fair and level playing field, because that is in the best interest of the patients we collectively serve. NASP is committed to working with all stakeholders and policymakers to ensure that all patients have access to the life-saving medications they need and the high-touch patient care and support services they deserve from the pharmacy of their choosing.
Hello, my name is Sheila Arquette, and I'm the President and CEO of the National Association of Specialty Pharmacy. I am delighted to welcome my very special guest, Hillary Gretton, to this episode of the NASP Podcast. Hillary is a patient-centric commercial leader with extensive experience in healthcare and specialty pharmaceutical analytics. As Director of Data Strategy at Claritas Rx, she leads the development and execution of advanced analytics initiatives that align patient needs with commercial objectives. Passionate about innovation, Hillary empowers companies to streamline patient access to therapy by leveraging AI, machine learning, and best practices. She holds an MBA and is a certified pricing professional. Today, Hillary will share how Claritas Rx supports manufacturers through their new Access Analytics product and insights from one of their recent white papers, From Prescription to Abandonment, how 31% of specialty medications go unfulfilled across therapeutic areas, highlighting key reasons for patient abandonment during pharmacy transitions. Let's dig into this paper and discuss ways these new published insights can help us better support patients. Hillary, thanks so much for joining me today.
It's lovely to be here with you, Sheila. Thank you.
So, drawing on your pharmaceutical background and the insights from your recent white paper research, can you share what you found? And specifically, what I'm thinking is, what are the biggest challenges facing today's market access landscape for specialty products, and how do these obstacles affect the patient journey?
Yeah, so Sheila, I think that's a really great question to kick us off on today's conversation. And this is a multifaceted issue for today's pharmaceutical companies, and especially when you look in the specialty, the rare orphan disease state, where you have a very small subset of patients that really need support and timely support. And I think the heart of all of this is data. There's not enough. It's scattered across different platforms, formats, and really navigating it is complicated by this constantly changing environment that we're seeing both inside and outside of pharmaceutical companies. You know, we have new executive orders that are coming out. There's evolving regulations. And then there's this really highly competitive market that we have with, fresh disruptors, new products, indication expansions coming out all of the time, and trying to keep your arms around all of this and to say, what is the best way to proceed forward? So you have, pharmaceutical companies that aren't just trying to collect this data. They're also holding ongoing conversations with specialty pharmacies and their hub partners and really trying to get this true 360 picture of what their patients' needs and what the barriers are that are in the way at this time. And so when these questions arise about the accuracy of that data, or thinking about when a partner realizes that there's an issue and then they have to restate it, adjust it, make people aware of it, that they're going to be doing a restatement, this really only deepens the gap between this real patient activity and then what that pharma company can actually see internally. So think about it. If a patient does something on Monday, the file comes in on Tuesday, that's sent over to the manufacturer on Wednesday, then they need to do a restatement. That might not come through until Thursday or Friday. That is a full week between when something has actually happened to a patient and then the pharmaceutical company being able to see it and potentially help or mitigate any risk that is actually happening. So think about that. Every day that's lost in that process means yet another delay in really delivering effective support along the patient journey.
Yeah. Okay. And what are the kinds of things that you're looking for? Like what happened to them on Tuesday? Like, what do you mean?
So I think that's a good question. Sometimes we can look at this and say, is the patient flowing through the patient journey as we would anticipate? So kind of going back to that benefit investigation and benefit verification, we might say it could take half a day or a day, that's fine. Or if somebody's going through the affordability portion and they might think about what the cost is and how to help mitigate that if it's potentially something particularly onerous for them. They might say, okay, they can sit in that stage for about 24 hours. But I think what we're looking for as a part of our patient journey analysis is to be able to say, is someone sitting far too long in a position? So are they sitting in the affordability for, let's say, 5 days? Well, that's a trigger,
Right.
that someone needs to go in and help that because they're stuck, or maybe there's some sort of miscommunication happening, if any communication is happening. But ultimately, I think that's it, is to be able to say, by market basket or therapeutic area, by brand, by patient segment, is this patient behaving as we would anticipate? Or is somebody kind of sticking out like a sore thumb, they're an outlier, and they might need some help? We might go in and say, or by we, I mean the manufacturer might go in and look at that and say, oh, it's okay. Patient Hillary Gretton is actually just having some difficulty with this, but she does not need our help. But it also could be patient Sheila is in that for 5 days, and she really, really needs some support because she's actually behind on product or at risk of not having enough product. So I think it's just kind of a mixture of things to say, is this patient appropriately where they should be given what we would anticipate?
Sure. You could probably aggregate this data too, right, for manufacturers. And if they have like a new drug launch, say, well, hey, and this is where you had pain points for this drug. If it's, a similar disease state or, patient population or characteristics, and you may want to make sure that, especially pharmacies know that these assistance programs are available, or that this blood work is going to be needed, or right, that these things typically get denied because of X, Y, and Z, and kind of be proactive with that.
So Sheila, if I can come back and talk with you, and next time, we actually at Claritas Rx have an amazing opportunity with performance benchmarking to be able to look at how products are performing and to be able to say, what have we seen within certain therapeutic areas, certain market baskets, thinking also about product life cycle. So I loved how you brought that in, right? What is normal? What is good? And what does good look like? And that allows people to create an analog or a scaffolding to say, where am I in my product life cycle? Did I just launch? And if so, what did other neuro specialty products look like the first 6-12 months? What did that persistency curve look like? What did that launch adoption curve look like? What did they do well? Exactly to your point, right? Thinking about creating quick start voucher programs. Did they offer PAP the first year? And then they said, okay, we realized that PAP is going to be X% of our budget. And then we know that we can bring that back down on year 2, because by then you've already built physicians, HCPs, payers that have trust and understand the value of your product and are much more willing to prescribe it as well as support it. So thinking about tracking these shifting policy and industry discussions like we talked about, especially as they really impact specialty pharmaceuticals. And these changing dynamics are on top of mind for everybody in the field, right, Sheila?
Absolutely. This year especially has been extremely busy, right, and challenging as we've, implemented that smoothing for Medicare beneficiaries and the IRA, right? What are those challenges? And now we're seeing, a 340B, pilot program rebate model being considered. And, we're trying to manage all of that, reimbursement challenges, and then also continuing to take care of patients who are individuals, right? They all have, different, different stories. They have different diagnoses. They respond differently. They have different social factors that impact, right, their ability to be compliant and adherent and to do well on these medications. So it's an awful lot of balls in the air at one time.
Absolutely. And I love, Sheila, what you just said about every patient as a person. They have a backstory. They have family, hopefully caregivers, hopefully, and that product is so necessary for them.
Absolutely. I think that's what's so to me, it's so incredible. I've been in this business for quite some time. And I think we're doing a little bit of a shift from population health management, right? Where we kind of fit, we kind of, it was like the 80-20 rule where 80% of the patients you could manage this way, you could expect similar results. Well, now we have all of these therapies that are targeted, they're personalized, but with that comes all of the challenges, right? Of these individuals and their responses. And like you said, their backstories.
Yes, absolutely. And I think that really reflects on why it's critical for manufacturers, and especially when you think about these patient support and the case management teams to identify where these patients are in their journey and, really being able to say what intervention is needed right now. So to your point about that 80-20, 80% of those patients probably go through, they're little or no touch, they're processing through at an expected clip. But then you have that other 20% that are really struggling for very unique reasons. To your point, it's not just a one size fits all. So you're thinking about that patient journey, and exactly as you articulated, right? It's so stressful. Patients have months, sometimes years of worry before they get a prescription. And they're finally say, oh, I have a diagnosis. I have a prescription in my hand. Well, that means I'm going to get my therapy within a few days and life is going to be better, or at least I'm going to remove a certain amount of stress. And then once they get that prescription, just getting that medication can even be a major hurdle, right? So you have these payer approvals and affordability concerns that are standing in the way. To your point, when you're thinking about these regulations and the 340B impacts, and that might put a pause in how somebody is then processing that prescription, if they're a hospital, if they're an institution, whatever that may be. So, it's interesting at Claritas Rx here, we actually analyzed data from 47 different brands. And we found that for every 5 extra days that it takes to fill a prescription, the fill rate drops by 30%. Think about that, 30%, right? So that means that many patients never actually start even their prescribed therapy. So they've gone through all that hassle and frustration and stress and driving and paying for parking at the hospital, only to say, for whatever reason, I'm going to abandon. So what we think is that if pharma companies can really use this data and you can pinpoint patients that are at risk of abandoning treatment and really step in with not just even support, but very nuanced, specific support for that exact situation that a patient is in, they can make a real difference in helping people to get on that right medication faster.
Right. And it's just amazing to me. I've worked in, different facets of this industry, and at one point I oversaw a prior authorization department, and I would tell my folks, when we deny something for somebody, we also have to have maybe this isn't what's right for you now, right? Based on our criteria, the guidelines, but this is what's right, because they don't get better, right? If you don't treat them, they don't just get better. And like you said, 30%, decrease. Where do they go? Right? What happens to them?
And that is exactly the key point. That is the area that we really need to make sure that we're focusing on, because no one's taking this because they feel like it, right? It's not candy. It's not the newest soda. It's a very necessary drug or therapy for them. And this is something that the white paper is really looking into, about what are these key drivers of abandonment, and really what are some of the things that are happening, because no one's going to go through maybe a year or a month or something of stress only to say, oh, I'm not going to move forward with it. So a lot of it is, the patient's denied coverage. That's really going to be payer related, right? And that was actually one of the biggest pockets that we saw, or one of the biggest buckets that we saw. There could be a lengthy prior authorization process, also known as a PA. And this could be something like you need to have labs done. You need to have a peer-to-peer review because of the high cost of a medication, or maybe someone's lack of familiarity. It was freshly launched, and they might say, how is this really differentiated from the current standard of care? You could look at things like affordability, right? So really high out-of-pocket costs, from a copay or a co-insurance. You might have a copay buy-down program if it's commercial. But if this is someone who's on Medicare, Medicaid, maybe they're paying cash, that might be a financial barrier that is too high for them. You could also look that there are breakdowns that we see all the time, sadly, as you're probably familiar with, Sheila, communication between the prescribers, the pharmacies, and the patients. You might have someone calling, leaving a voicemail, and you're playing phone tag for the week. Somebody might say, hey, we need to have this delivered during the work week. And someone might say, I'm at work all day. I work first, second, third shift, whatever that may be. I'm not going to be home to sign for it. So these are all just this maelstrom of events that could happen that are resulting ultimately in abandonment, sadly.
Sure, right. It's all about the coordination. And when
Exactly.
one piece of that breaks down, the results can be disastrous.
Exactly. I think this really highlights the importance of care coordination as a team and as a village.
Absolutely. And effective communication, right? And setting expectations and making sure, I think, especially that patients and caregivers understand, because I think as healthcare providers, sometimes we forget, like you said, that journey that they've been through to get to this point, to be ready for this medication. And now when that doesn't go well, it's super easy, I would think, to just say, oh, the heck with this, right? It's too
Exactly.
hard.
Exactly. Patient burden is a huge issue. And how do you make sure that you're clearing a lot of those barriers through and removing those hurdles and really understanding and putting yourself in their position exactly as you articulated, Sheila, versus having a manufacturer first perspective?
So we've seen access analytics mentioned in the marketplace. So can you provide a high level description of what that is and how will it help address current challenges in market access and patient journey analytics?
Absolutely. And love to talk about this. And I think one of the big things that we have at this point in time is everybody, patients, like we talked about that patient burden. You think about manufacturers, you think about anybody in their role. They have a million things that they need to do in the 8, 9, 10, 12 hours that they're working in a day. And just really trying to say, what is actually going on? Not just the noise, but how do you get that signal in the noise? And I think ultimately you can't improve what you can't see.
Right. Absolutely.
Thinking about how do you have visibility to this data?
Uh-huh.
And really, what Access Analytics is so unique is that you get insight into that patient journey with our upgraded dashboards that we have. And, it's able to really easy to explore our patient data. You can spot some trends and you can really quickly identify barriers. So, going back to the thing that there might be, 6 things that are preventing a patient from getting on board. And a manufacturer might say, I don't know which one, or really, is there something that's unique to this pocket and subpopulation versus another? So really, it allows a manufacturer to look at this rich data and put it into order and say you can have these really clear, intuitive visuals. So it's not trying to kind of, tilt your head and squint your eyes and saying, I think, but really you can see it all out in front of you across your portfolio, across your brands, across your patient population. And then additionally, you have some really advanced filtering in Access Analytics. And it allows teams to see, you can look at the overall results, or you can really zoom in on granular patient populations or even specific patients. So you give everyone really the access and insights that they need. And I think to something that you said earlier, this is really important because we're having more patients that are transferring between specialty pharmacies. So,
Mhm.
one of the key aspects of this is really having that visibility to patient longitudinal activity. So, all the way
Mhm.
from start to finish, regardless of whether they go to another pharmacy. So, this Access Analytics platform actually allows you to track those transitions. And our data shows that most cancellations happen during the coverage stage. So, we saw about 72, 79% with rates that were even higher at PBM owned pharmacies. And so by the way, when we say PBM owned pharmacies for this white paper, this is just to say that that is a uh, one that is vertically aligned
Mhm.
to a PBM. So we know that there can be a lot of different descriptions or definitions of independent versus PBM, but that is what we have used for this analysis. And so the fact that when these increase, when you have these PBM owned pharmacies, now these insights really empower teams to take action and keep their patients on therapy and monitoring. If it goes here, we need to take this action. If it goes there, we need to take that action. And one really important aspect that we should call out is just basically that yes, there may be slightly different definitions of PBM versus independent, but I think ultimately at the end of the day is to take a huge step back and say, based on these commonalities that we see patients tracking to, what are ways that we can then support them?
Do you have any insights as to how this, vertical integration impacts that? Like, why are we seeing that? Do you know?
And that's another really good question. And ultimately, again, kind of looking at it from an independent versus vertically integrated PBM, we see that independents generally they're much more community based. They can have a little bit more flexibility due to less rigid of protocols that may be established as what you might see in a PBM owned pharmacy, in which a PBM owned pharmacy might say you need to talk to this group first, this group second, a very rigid set of protocols in which how to respond to a patient. Whereas you might see with an independent, you might have someone that may be a little more flexible, able to call or find a way to creatively respond to a patient need. So we think ultimately the structure that provides PBM-owned pharmacies and enables them to meet these high-level goals, ultimately these independent pharmacies are going to be more flexible and able to support patients in a different way.
So, what are the top 3 ways that you know that clients will benefit from Access Analytics?
So I think the big part here is that it's really easy to overlook the challenges that patients face just trying to get on treatment, right? So going back to what we talked about at the beginning of this, there's really so many barriers that are out there, and it's our job to find ways to help remove them. Identify them and say, this is the next best action. This is how you're going to kind of clear the playing field here. So I would say this is where Access Analytics makes a real difference. And really thinking about it, by cutting through these overwhelming amounts of data that organizations deal with today, we can help pinpoint the biggest areas of concern or risk and really give targeted interventions much more effectively. Think about it like laser focusing. And going back to that data deluge that we were talking about, how do you get that noise, remove it, and get that signal and parse that out? So I would say that clients at Claritas Rx have seen 3 distinct key benefits. So the first is that clients need a single comprehensive view of the entire patient journey. So they need depth, breadth. And we need to see everything from enrollments and approvals to therapy starts. You're going to look at copay support and ultimately adherence, right? So once someone's got on therapy, that doesn't mean that's the end of the road. You need to make sure that you're clearing any potential barriers that may occur afterwards, thinking about reauths, thinking about changing insurance, all of that I think all of us as patients have ultimately gone through. And then you have these multiple stakeholders. So you're thinking you have your hub teams, you have your payers, you have finance, all the way up to executive leadership. They've all expressed finding value in having a unified visual approach and really giving them the ability to understand and improve patient access and support. There's this need to have an easy to view executive dashboard that provides key business metrics and performance snapshots across multiple timeframes. Really, so it's rolling up all that rich information because we all know the CEO doesn't have time to go through a 30-minute deck, right? They want to see everything right now, preferably on their iPad, and being able to say, okay, that's how we're performing as a snapshot in time. And I love this that we had one customer put it, we get a usable dashboard with data from as recently as midnight, and by 8 a.m. the next day, we have the full picture. So that level of real-time insight is so incredibly powerful for making these really timely and informed decisions.
How do you get the data to do that?
So that is an excellent question as well. And this is actually pulling in from our clients and being able to amass all of it and put it in a very streamlined, clear format for them. Because oftentimes, I did this myself. I was commercial data strategy. And you're trying, like we talked about, you can have it in all these different formats of spreadsheets and CSV files and whatever it may be. And we actually can take all of that from the different providers and be able to affinitize and harmonize it and then put it into this dashboard that people can then review, look at, and say, aha. So we're basically turning people from being spreadsheet jockeys into analysts and being able to support the patients.
So how does Access Analytics change daily work for pharma, commercial, and access teams?
So as we just talked about, I think this really allows people to focus on the necessary people and populations during the day. So right now we see a lot of people that are doing this time-consuming manual data collection, and they're trying to massage the data and cleanse the data and put it together and then say, okay, once they've done all of that, let's make some sense of it. So really what Access Analytics allows you to do is just eliminate all of that time-consuming collection and analysis and really automate this reporting. So that way you're streamlining your operations and you're enabling your teams to focus on patient care and program improvement. And then at the same time, you're gaining this expert actionable insights for enhanced forecasting. And you're also having a lot stronger market access results. So you're taking people away from kind of being data wranglers with their lasso and with all these spreadsheets, and really being able to say, once you get to the office, once you open up your emails, you can look at something that is clean, defined, logical, and you can spend your hours focusing on that.
So those are great insights into how Access Analytics help teams every day. So let's switch gears a little bit and address some common myths about specialty pharmacy in the patient journey. Given the complexity, how do specialty pharmacies make sure patients stay safe and on track with their medications?
So, what we see is that when a physician decides that a patient needs a specific medicine, acting quickly is crucial. And I think, Sheila, this is something that is near and dear to your heart as well, right? This isn't just for the quality of life, but it's also potentially to slow or even prevent a disease from worsening. So you need to make sure that you get this on quickly. And this is going to impact the entire care ecosystem, right? So we talked about before, no man is an island. You have patients, you have families, you have caregivers. And it's really essential to have clear visibility into where that patient is along their treatment journey. So think about it. Are they waiting on a benefits check? Which, okay, that's fine. It might take a little bit of time for that. You might be working through affordability issues with the specialty pharmacy team. Then you have to think, well, if there's a problem, the specialty pharmacy, the hub, and the manufacturer, they all need to be communicating and coordinating a solution for that patient. And so this is exactly what we actually covered in a recent Claritas Rx white paper, which I helped author very proudly. And we highlighting just how important patient visibility is, right? A lot of things can be very opaque. It can be very difficult. You're already dealing with a host of other things in your personal life. And now you have this component going on. So getting and staying on therapy can be delayed every single time a prescription transfers between pharmacies. It doesn't matter if it's an independent to an independent, independent to PBM, or even within vertically aligned networks. So each transfer that happens adds another step, increasing the risk of patients not starting or staying on therapy. Think back to that 30% number that we had. Each time that X number of days have transpired, there is a greater chance that that patient will not fill. And so our solution really helps users easily track and evaluate these transitions using that specialty pharmacy and the hub data. And I think also it standardizes data from different sources, like we talked about, to create these meaningful KPIs, making it easier to compare the results at the end of the day. And really, the benefit of this is that it reduces miscommunication and it saves valuable time and effort. And that in turn lets their teams focus on supporting patients and not chasing down spreadsheets.
So why do many patients abandon their specialty prescriptions before they even start therapy?
And thinking back to what we started talking about a little bit ago, this really goes against what you might expect. And this is something that we explored in our white paper. And when we talk about patient abandonment, so thinking about that's when a patient never even fills after they get that first prescription, there are many reasons behind it. And barriers can include things like these really complex payer requirements, like we talked about, that extra lab work, that peer-to-peer reviews, needing to coordinate with the insurer. And both of these take a lot of time and efforts. And like we talked about before, these financial concerns, these high copays, these deductibles, think about the impact of maximizers and whatnot. And then even those communication breakdowns. One of the sad things that I've really seen in my time with pharma was that there was something as simple as outdated contact information that a pharmacy or an office had. And so you had a patient saying, I really need to get this medication. The pharmacy says, I've tried to call them 3 times. And oftentimes after the 3rd time, they might close out that prescription and say, I tried to reach them. I don't know what's going on. So it's something as simple as that can really lead to a lot of missed calls and frustration. And then when you think about it, any one of these hurdles can be discouraging on its own, right? It's very frustrating. But then you can have the opportunity realistically is that they're going to stack up. And that can just become so incredibly overwhelming for patients and caregivers or anyone that's involved in this process. And sometimes, this can lead to patients just simply giving up on their medication. They might just say, I'm having to go to a doctor. I'm having to get poked. I'm having to get a biopsy. I'm having to do these sleep tests. I'm having to do whatever it may be. And now you're telling me after doing that and working, now I need to just sit here and follow and bird dog something up. And so it just might say, I'm going to stop. I don't have the energy for this. So I think going back to it, even if it really seems surprising, that burden can just be too much. And they might just say, I'll deal with it later. And that just sadly really turns into never starting therapy at all. And Sheila, I imagine this is something that you've had to struggle with.
Absolutely. I hear from our specialty pharmacies all the time that coverage and affordability issues, are definitely barriers, and do cause patients to walk away. I think also, again, it's that understanding, right? I mean, I think we've seen such a shift from the days when, patients would go and they'd follow everything that their doctor said or their pharmacist and, not ask any questions. Now today people want to understand, why am I doing these things? And I think it's if they understood better, why do we have to do these things? Why are there so many steps to make sure that this drug is appropriate for you? I think maybe, we would get better buy-in, right? Or people wouldn't lose that motivation to keep going. Really, it shouldn't be so hard, but I think kind of making them part of the process, doing it with them, not to them, is key.
Absolutely, Sheila. I really love what you're saying there, and thinking about the fact that how can patients and their caregivers be better advocates for them. But I think conversely, like Claritas Rx is helping companies to be advocates for these patients as well. And, thinking about all these key factors, and it's just so important to remember that technology and data integration can really help streamline the patient journey, and it can help reduce those barriers and really helps put focus on where there's value, right? On the patients and caregivers who need that assistance. So using that knowledge, using technology, all of this to help everybody be proper advocates so that patients can get on timely and appropriate therapy.
Absolutely. One of my least favorite phrases is, we've always done it this way, right? And I think having the data and having this technology and these insights that you can provide helps specialty pharmacies or, some of your other partners to kind of look at their processes and refine them and retool them, right? And as the treatment journey and the patient journey and these incredible medications continue to evolve, so must our processes.
Exactly. And just because we've always done it that way doesn't mean that current state should allow that to continue. Things are constantly evolving. Again, like you talked about, regulations, processes, technology, all of that. So why not leverage and utilize what is available now and really give it a chance for companies to take a step back and say, not what have I done, but what could I do? What is that? What is the big blue sky approach? What could be the way that we can make sure that we're definitely supporting people effectively, efficiently, and really empower ourselves to take that next step.
Awesome. Well, thank you so much, Hillary, for chatting with me and sharing this valuable information.
I've had a wonderful time today, Sheila. Thank you so much for having me. Really enjoying this conversation about this patient-centered care and access analytics, and allowing me to geek out with you.
Awesome. As a reminder, NASP corporate members are invited to be my guest on one complimentary podcast per year. For more information about this or other NASP membership benefits and events, please feel free to reach out to membership@naspnet.org or visit our website at www.naspnet.org. Until next time, have a great day.